Let's go ahead and get started. Hello, everybody, and welcome to PrideLink Online and to this webinar on HIV and STI resources during COVID-19. I'm really excited to have everybody with us. My name is Ethan Johnstone. I am the lead community builder with PrideLink. For those who might not know much about PrideLink, we are a community-based nonprofit here in the Upstate, and we serve the LGBTQ plus community in all 10 counties of upstate South Carolina. We provide health and wellness services, social support, access to resources, and we also provide LGBTQ capacity building to community providers as well as education and training. I am really excited to be joined today by Carlos Alvarez, prevention specialist with AID Upstate, and I'll let him introduce himself in just a minute. This webinar is part of our new programming, PrideLink Online, which is in direct response to the coronavirus and social distancing guidelines. We know that it's still important for folks to have the opportunity to connect with one another, learn new tools, get connected to the resources that are available. And we know that the resources, knowing what resources exist right now can be sort of difficult. So we hope that this webinar in particular is helpful in navigating that. So before we get started, I want to mention again that all of the attendees will have their audio and video muted throughout the entire webinar. But we want you to make sure you get your questions answered and engage in dialogue. So any questions that you have, please put those in the Q&A box, and we'll either answer those as we go along or save some time at the end. And then if you want to engage in dialogue, feel free to do that in the chat box. All right, so let's go ahead and get started. Carlos, why don't you tell us a little bit about yourself and what you do with AID Upstate?
Thank you, Ethan. Hello, everybody. Well, my name is Carlos Alvarez, and I am originally from Colombia, South America. And I've been working for the AID Upstate now for 5 years as a prevention specialist. And my motto will be like, if you need help, this is the place.
Awesome. Yeah, thank you so much for being willing to jump on this webinar and share just about AID Upstate and the type of services that y'all provide. So can you tell us a little bit about AID Upstate for folks that might be completely unfamiliar with who AID Upstate is and what type of services y'all provide? Can you share a little bit about that?
Yes, AID Upstate is a nonprofit organization that has been around here for more than 30 years now. And we provide services for the counties of Greenville, Anderson, Oconee, and Pickens in South Carolina. Now, we mostly focus our attention in providing HIV/AIDS assistance, not only testing, but also treatment for people who does not have the resources to go out there and do it through. We also work a lot in prevention and STD screening.
Awesome, thanks. And then as far as sort of the effect that coronavirus and social distancing has had on any of the services, can you talk about that? Has it affected HIV testing? Has it affected STI screening? Any effects that has had on y'all?
Well, actually, this pandemic event with the coronavirus has affected us all. And yes, here we have set a few changes. You know, if we compare it with the things that we normally do it, we also have, we have social distancing as a key. The staff is not working full pace. We are trying to keep some staff working from home, so we kind of rotate. We are also serving people kind of in the outside, some sort of drive-through system that we have now. So we don't let people get out of their cars. We do what we do from the outside, but they will stay in the car. That's mostly what we've been doing. Now in our other departments, they have also set a set of rules, like in the medical department and in the case managers department. So we can still providing services, but we cannot put our clients or ourselves at risk.
Gotcha. So if people want to access some of the services, say they're a new patient, and they are needing to get or interested in getting tested for HIV or screened for an STI, how would they go about accessing those services?
Well, in that scenario, they will have to call and set up an appointment, because normally we take walk-ins, but because of this situation of the coronavirus, we're limiting that service. So people have to call, make an appointment, and then we go from there. We gave them the instructions, we gave them a mask once they're here. And if for some reason the weather will not allow us to have the patients out there in their cars, we will bring them into the building with a lot of restrictions. One of them will be the social distancing, and the other one will be wearing a mask all the time.
Gotcha. So it sounds like folks would call AID Upstate, and can you give that number so that that folks will have that even in the recording of this?
Yes, of course. Our telephone number is 864-250-0607. And then from there, they could be reached to any department they need to be seeing at.
Gotcha. Folks would call that number, figure out what service they need, and then if, for example, folks needed HIV testing or STI, it sounds like they would stay in their car, get that test completed, and then what would happen after the test is done?
All right. We normally work with rapid HIV testing and rapid hepatitis C testing. Those results will be provided at the time of their visit before the patient left. Now, when we test for gonorrhea, chlamydia, syphilis, trichomoniasis, or hepatitis B, or hepatitis C confirmatory test, the client has to wait at least for 3 days before we reach out to them to give the results, because we don't do that, those labs over here. We send them to the health department lab in Colombia. So it takes a little bit to get those results.
Okay, gotcha. Yeah, so can you talk a little bit about why it's important for folks to get tested, and then also who should get tested and how often should folks get tested?
Well, one of the reasons, because we would like to have pretty much everybody who is sexually active tested, is because people assume that, we normally assume that we have to have a symptom to go and get checked by the doctor. And now when it comes to HIV, it doesn't matter what Google search says, because you Google HIV symptoms and it will throw a whole bunch of things. Now, in reality, HIV has no symptoms. You're probably 8 to 9 years after the time of the infection, and at that point, it's not HIV no more. It might be AIDS, and it might be too late. So we encourage everybody to get tested if they are sexually active or they have been having.
And the last thing you said was unprotected sex. That sort of broke up a little bit. Just want to make sure.
Yeah, unprotected sex.
Okay, gotcha. And then how often do you think that people should get tested? So say if somebody got, they got tested 1 month, they continue to be sexually active with maybe the same or different partners, how often should they get tested?
Well, by DHEC politics, we don't test people. If like they were tested today, we wouldn't be able to test them until 3 months after that, unless it's a significant and a particular risk situation that they were exposed to, say, so that they knew that the person was HIV positive in a range of detectable viral load. So that will change the situation a little bit. so we can go ahead and get tested. But normally every 3 months for that people who are very sexually active and normally don't use protection, but we will recommend it to do it once every 6 months.
Gotcha.
Now, I would like to make a notice that if people are having symptoms of bacterial infections, the situation changes because, you know, when it comes to bacterial infections, there are symptoms normally. And if they have symptoms, we go ahead, test them, and send them out to get treated.
Okay. Can you talk a little bit about what those symptoms would be for folks that might not know?
It will depend on the bacterial infection. If we talk about gonorrhea, we will see pain in the urination process. We will see discharge that goes from clear discharge to yellowish or sometimes greenish discharge, very painful. You can actually smell it. An advanced gonorrhea can produce inflammation of the testicles in males and inflammation of the urinary tract on females. Now, when it comes to chlamydia, the symptoms are similar, but less strong than the ones on gonorrhea. Now, we talk about syphilis. Syphilis has a completely different situation because when it comes to syphilis, we will see a sore, painless sore that heals within days. So that's why sometimes we don't really pay attention to that type of sore because it heals. Now, it goes absent for several months, and then after that, we can talk about secondary syphilis. When it comes to secondary syphilis, we can talk about rashes, some dark dots in the palms and in the sole of your feet, but it goes away too. So if we don't pay attention to that, it comes back in a few years, but at that point, we might have some cerebral syphilis, which is, it can lead to dementia and some other neurological problems.
Gotcha. Yeah, that's helpful. I think just for folks to understand what the symptoms are, and sometimes it's easy to go down a Google trap and not have accurate information. So that's helpful. Thanks. And then as far as prevention, so can you talk a little bit about PrEP and, how folks would get access to PrEP, who would be eligible, or who would it be helpful for?
Well, in 2012, PrEP was basically put out in the market for people whose partners were HIV positive, so they can have a more normal sexual life, if you can call it that way. PrEP is an acronym that stands for prophylaxis. What it means that people will be able to receive a pill every day, and that pill is an antiretroviral medicine. Now the commercial name is Truvada. And people will take it every day. And in males, after 8 days taking this medicine, you will be protected against HIV. Now, we still encourage people to use condoms as well, because PrEP is only one more layer of protection against HIV. Now, in women, it takes 22 to 23 days to build up enough protection in the vaginal tissue. So you can notice that it takes longer on women than in males because of the type of tissue that is used for sex. Now, we have a PrEP program, but at this point, we are not taking any new patients in the PrEP program because of the coronavirus crisis, but we do have that program. We recommend it for people who think that they are exposed enough to HIV so they can stay protected. We have two types of services on that matter. One is the one that people will use when they have insurance, so because PrEP is very expensive, so they can run it through their insurance. Or we have another service that is the one that we provide and get the labs to pay for these medicine for people.
Gotcha. Yeah. Thanks for talking about that. We had one question come in. It says, should folks take extra precautions with casual sexual encounters during the COVID-19 crisis?
Hold on just a moment.
Hmm.
Well, that's a very difficult question because it could lead to misunderstanding situations. But what we will recommend at this point is try not to have casual sex, because when it comes to sex, it is very difficult not to expose yourself to coronavirus. Now, some people there are saying that people can do have sex without kissing. We will recommend not to have it unless you have a regular partner that you have sex with and you can kind of be sure that that person has no COVID-19. But going like online and meeting somebody who you don't really know what's going on will be a like kind of everyone's decision at this point.
Sure. Yeah. Yeah. It's tough to answer that sort of objectively, and so yeah, everybody just encouraging folks to stay safe and follow those precautions of social distancing, I think is best. And then as far as the LGBTQ plus community, so a lot of times it's not uncommon for folks, especially here in the upstate, to have a lot of distrust about service providers or accessing services. And sometimes that comes from, personal experiences of discrimination based on their sexual orientation or gender identity. Is there anything that you want to say to LGBTQ people that might be sort of fearful or nervous about accessing services at AID Upstate?
A lot of times people are fearful because they don't want their information to be out there. They don't want people may know about sexuality, but everything that we do it under HIPAA regulations. That means that all the information that we have, we just keep it in here. We normally have people signing a consent form for us to go ahead and test them for whatever we are testing. And in the same manner, when we disclose results, we make sure that the person that we tested is the same person that we gave results. That's why we don't send them through email if we have not received that permission from that person. And we ask clients to come and pick up their results in paper if they want them to, because it's very difficult. You know, you have the mistrust of people that they don't really, we have these counties that are very comprised and people know each other pretty much. Yeah, but we are always welcome. We have a big group of professional people that uh, will help everybody. And now, actually, I am very glad I can speak for the company and say that people are very trustworthy with us. They really trust us, and we have been around here for like I said before, 30 years. So in our group of regulars, we have a lot of trust. Now when we have new people, we have had the possibility to engage them very easy after they see how we do, how we work with them, how much support they receive from us.
Yeah, that's great. It sounds like it's a really personalized, individualized process.
It is.
So, yeah, and that would put anybody at ease, I think. So it sounds like y'all are really intentional about that, which is awesome. Yeah. So those are all of the questions that I have. I want to just open up time for folks to put any questions that came up in the Q&A box. And while you're thinking of questions or putting those in, also just let you know that this is being recorded. So we will send this out via email as well as post on social media so that folks that weren't able to attend this webinar can get this information, and you can share it out with your networks as well. So I don't see any questions coming in. So we will go ahead and wrap it up. Thank you so much, Carlos. I really appreciate you taking the time to jump on this webinar, share about AID Upstate and the resources that y'all provide, and just get folks the education that we still need. So I really appreciate it.
You're very welcome, Adam, and you're very welcome, all of you.
All right. Take care. Bye, everybody.
Bye-bye.